Hello, my name is Linda Buckhold, and I'm an insurance agent, and I am here to talk to you about Medicare and give you some basic information that you may not know. But if I haven't covered it, feel free to give me a call. I love talking to people. Hello, my name is Linda Buckhold. Thank you for joining me today. I'm here to discuss the basics of Medicare. First thing about Medicare, it is designed for individuals who have turned 65 or individuals under the age 65 who have certain disabilities and they received disability insurance from Social Security. And on the 25th month, they move from being on their current insurance to Medicare, and they need to make a decision. And that can happen at any time of the year. So, the first thing I want to talk to you about is you've got your Medicare card in the mail, and you're like, oh, I'm ready to move forward. Or you're like, gee, I think I'm going to be 65 in about 4 months, 5 months. And of course, that's coming of age of what we consider seniors, even though they've changed the times now and then. But truthfully, to me, it's 65. About 3 months before you turn 65, it's always recommended that you reach out to Social Security and you apply for your Medicare, whether or not you're going to be doing your Medicare benefits. And there's lots of options available because you may still be working. You have private insurance. And so you're like, well, do I really need to do this? Well, the Part A, which is what you've earned, out of your paycheck for the last so many years, but you still have to do 40 quarters, which is the minimum of 10, is free. It's at no cost for a premium. Now, there is cost involved in using the services within the Part A, and it is primarily designed for hospitals. And let me go over those different things. Part A covers hospital, it covers skilled nursing facilities, hospice, and for the life of me, I don't know why, 3 pints of blood. Those are the basics of what it covers. And then there is the Part B, and that you pay a premium for. So for the medical, that covers seeing a primary doctor, a specialist. It includes your Part B drugs, which is like your chemotherapy and your if you've had an organ transplant, the anti-rejection drugs. So there's a whole list of drugs that they go into detail on. Your lab work, your x-rays, your ambulance service. And so Part B is the medical portion. It's the people part of your Medicare, where I think for Part A, you should think of it's the building portion, the hospital, the bed. And so currently on Medicare pays 80%. And you are now responsible for 20%. And you think, well, that's not bad. An 80-20 plan isn't a bad plan. But there's no limit to the 20%. Now, it is based on contractual rates with the doctor that you're seeing that Medicare has set up with, the doctor in the hospital and the facilities that are Medicare providers. So 20% of whatever that contractual rate is. But there's no limit to the 20%. So if you have a bill that is a $100,000 bill, 20% of $100,000 is, you got it, 20 grand. So that's why insurance companies started providing things like supplements back in the 60s when I was a kid. You were a kid too. for most of us baby boomers. So insurance companies provide what is called a Medigap. You may have heard of that, or a Medicare supplement. Those are where the 20% is pretty well being paid for, but there's a lot of plans available. There's the A, the B, the C, the G, the F, the K, the N, all of those plans, and you're thinking, but I don't get it. Well, what they primarily do, they've designed it, and Congress has set the standard. So it doesn't matter what company you're doing business with. There's several points that I want you to think about when you look at a supplement. With supplements, you make a premium payment. So for your A, you're not making a premium payment. You do have co-pays and co-insurances. For B, you do have a premium payment plus co-pays and co-insurances. And with a supplement that are sold by private insurance companies, they're going to help pick up that 20% and those co-payments and co-insurances. And you have to decide, what are you willing to pay? And there's lots of choices out there. And I really think there's probably well over 100 insurance companies that offer that product. It's just, remember, a plan A is still a plan A. It's been designed by Congress. They're the ones that come in and say, this is what it's going to have to be. This is what it's for. And so what you really want to look at when you're making a decision on a supplement is, what is the price and how strong is the company? And when I need them to make that 20% co-insurance and co-payments for me, are they going to still be here? And those are questions that you have to do in your research, and that's why you use somebody like me, an insurance agent, because we're living and breathing this every day. Then there's other plans. There's a C. See, notice I didn't say a C. Maybe I said a C, but there's the Part C. So those were plans, and they're called Medigaps and supplements. Now we're going to talk about Medicare Advantage plans, which are awesome. I love them. And the reason why I love them is, remember the plans we were talking about? Primarily for Medigap plan or a supplement, they're underwritten, which means that the insurance company can make a decision whether or not they will accept you. It's based on health, and some companies rate you based on smoking, tobacco, the use of tobacco, and it has a premium attached to it. So, but Congress said, look, 3 months before somebody turns 65, the month of their birthday, and 3 months after, you want to sell the American public a Medigap or a supplement, you have to take them no matter what their health. It's just the way it's going to be. You can't be underwritten. So you've got a 7-month window to join a Medigap. And if you don't do it within that time period, you could possibly be turned down. Doesn't mean you will be, but it's really based on health. And so when President Bush wrote the bill for the Part D and Part C, and it was effective January 1 of 2006, that changed it a lot, because there were millions of people that didn't or couldn't afford a premium. And they're like, well, I'll just stay on original Medicare, and I have this, the premium I'm having to pay for my Part B, and I've been healthy my whole life. So in my budget, I just can't do it. And there was also lots and lots of issues with drugs. And prescription drugs were just very, very hard on somebody who didn't qualify for Medicaid. But that's not part of our conversation today. We're trying to stay focused on Medicare. So the bottom line is this. Part C's came out, and they're called Medicare Advantage plans. And there are many, many choices. You start looking in a rural area, there's fewer choices. And then in a urban setting, there's much more choices. And then you get all these choices to pick, and trying to figure out what is best for you and understanding the terminology and the vocabulary is a lot of fun. So there is a Part C, and most Part Cs include what you're doing is you're hiring an insurance company to manage your Part A, manage your Part B, and provide you with a Part D, which is the prescription drug portion of it. Now, there are some Part Cs that don't have it included, and you have to pay attention when you're reading something called a summary of benefits. And so that is kind of an overview. They just manage it. It's managed by a private insurance company, and there's a lot of choices. There's HMOs, PPOs, HMO POSs, there's PFFSs, and there's MSAs, and there's cost plans. And to learn and understand what each one of those mean, and cost plans aren't even across the country. They're only in certain states. And MSAs are medical savings accounts. They're in a lot of counties and a lot of states, but not everywhere. But the majority is you're dealing with something called a PPO, which is a private fee-for-service, not a private fee-for-service, but a PPO is a primary provider organization where they go to a doctor, they get a contract, and then the doctor is willing to see you at a contractual rate with that particular insurance company. Whereas an HMO, they go to the doctor or the hospital or the facility, and they contract with them to do managed care. So there's different kinds of plans that are available under the umbrella of Medicare Advantage plans. Then there's standalone plans, which are the Part D. So the Part D plans, and there's tons of them. Like in some counties, I'll open it up and say, okay, well, how many Part Ds are in this county? And there'll be 27 Part Ds. And they're great. It really makes a difference in helping you with your budget. They pay for the prescription drugs, and they have contracts with the retail, or they have mail order facilities. And you just have to decide, is that pharmacy in the network? Is it a standard? Is it a preferred pharmacy? Is it a standard pharmacy? Or do I just want to have my prescription drugs mailed to me? And so there's lots of choices, and that is why it's always good to sit with an advisor who will sit and talk to you and listen to what your needs are and to help you try to figure that out. Because it can be daunting, even for me. And I study and live and breathe this stuff every day. So I hope I helped you. Oh, and also prescription drug plans are ran by private insurance companies. So that was part of that piece that came in January 1 of 2006. I can't even remember what it's called right now, but that's okay. This is just a test. Thank you for listening to me today. I hope I've given you some good nuggets of information, and talk to you soon.